My name is Derek Tabor, and I, along with my colleague Marlon Laud Sharp, are hosting this technical assistance workshop or webinar for MFA MD 20 007. Here are a few tips for our webinar today. Everyone will be put in listening mode. We've muted your mics, but if your mic is not muted, please mute yourself. Participants may ask questions using the chat feature. Questions will be answered during the Q&A session at the end of the webinar as time permits. These slides and a recording of today's webinar will be available on our website as soon as possible. This is our agenda for this afternoon. We have 5 different items we want to address, and so it's going to be quite full, and we're going to get started right away. The NIH established the research centers and minority institutions in 1985 in response to congressional interest in expanding the national capacity for research in the health sciences by providing support to institutions that offer doctorate degrees in the health professions or health-related sciences and have a historical and current commitment to educating underrepresented students and for institutions that provide healthcare services to medically underserved communities. NIMHD recognizes the important role such institutions play in supporting scientific research and providing health care in underserved communities. These institutions are uniquely positioned to engage minority populations in research and in the translation of research advances into culturally competent, measurable, and sustained improvements in health outcomes. NIMHD invites applications from eligible institutions to establish a national coordinating center for NIMHD-funded research centers in minority institutions. These are RCMIs. The RCMI Coordinating Center will work closely with key personnel at all RCMI specialized centers and with NIMHD staff to help the centers collectively achieve their objectives to, and there are 6 of these. 5, enhance institutional research capacity within the areas of basic biomedical, behavioral, and/or clinical research. 2, enable all levels of investigators to become more successful in obtaining competitive extramural support, especially from NIH, particularly on diseases that disproportionately impact minority and other health disparity populations. 3, foster environments conducive to career enhancement with a special emphasis on development of early career investigators. 4, enhance the quality of all scientific inquiry and promote research on minority health and health disparities. 5, establish sustainable relationships with community-based organizations that partner with RCMI centers. The RCMI Coordinating Center will be responsive to requests generated by RCMI site key personnel, NIMHD, NIH, the scientific community, and the general public. Eligible applicant institutions for this FOA are limited to recipients of RCMI awards through select RFAs. These are RFA MD 17-003, 17-006, 18-12, and PAR 11-32. I want to now go through the coordinating center objectives. These are provided in the RFA, and so I want to make sure that you go to the RFA and be sure to read them in detail, but I'm going to cover some of them here. So the RCMI will collectively advance the science of minority health and health disparities through intellectual exchange and collaborative interactions that enhance research capacity and competitiveness at participating institutions. Supporting information exchange, sharing of scientific expertise and best practices, leveraging research resources and scientific dissemination across RCMI sites are considered essential to the success of the RCMI Coordinating Center program. The RCMI Coordinating Center is expected to help RCMI investigators take advantage of research and career development opportunities and address research needs as they arise in priority areas of basic biomedical, clinical, and behavioral and social sciences. This can include promoting submission of applications by RCMI investigators to relevant NIH funding opportunity announcements, as well as ongoing NIH programs to support the development of early career scientists, such as research supplements to promote diversity in health-related research, and educational programs like the NIMHD Health Disparities Research Institute. The RCMI Coordinating Center will also assist efforts to build capacity in RCMI U24 centers to not only engage community in research as partners and participants, but also to effectively communicate and disseminate their research findings that advance scientific knowledge at all levels to their communities. Specific discoveries that are useful to the community and have the potential to benefit health and well-being at the neighborhood, community, and population levels can be promoted. RCMI CC activities are expected to align with and support the objectives of the RCMI U54 centers in 4 key domains. 1, project administration and coordination among sites. 2, research resources to support scientific projects. Early stage investigative development and mentoring. 4, community engagement. Toward that end, the RCMI Coordinating Center must have the following essential functions. No, there are a total of 12 different bulleted functions. I'm not going to go through them at all, but I wanted to make sure that I brought your attention to them. Please see the RFA and look at it carefully and thoroughly to make sure that you're aware of these 12 essential functions. Additional activities, those that are essential, may be proposed to promote collaboration amongst RCMI sites, contribute to the professional development of RCMI investigators, encourage interactions between the RCMI program and other NIMHD and NIH-supported resources, and enhance the value, visibility, and scientific impact of the RCMI program. Examples include, but are not limited to, providing visiting scientists opportunities across NCMI U54 centers for pilot project recipients to foster collaboration and career development, and for senior investigators to promote mentorship and scientific exchange. Coordinating submission of peer-reviewed manuscripts by RCMI investigators for publication, thematic, special issues, scholarly journals. Fostering new or existing partnerships with local, county, or state health departments and small for-profit businesses to address community health concerns. Assist efforts of RCMI U54 centers to assess or characterize improvements relative to established baselines in health-related knowledge and health outcomes at the community, neighborhood, and higher levels resulting from dissemination of research advances. I want to cover the application information that's also, again, provided in the RFA. This competition is limited to recipients of RCMI specialized centers or RCMI G12 awards made under the aforementioned RFAs, and shown here once again. Only one application can be submitted. This is normally based on your institutional, your IPF number or DUNS number. Also, only new applications can be submitted in response to this FOA. New applications are those applications that and they refer to those not previously proposed or one that has not received prior funding, also known as a type 1. I've included a link here for the new applications and description of those in the NIH glossary. This slide is included to show the eligibility for those institutions that can submit under this RFA. I'm not going to go through this. The fact that the competition is limited to those that have had a RCMI grant in the past or a G12 grant in the past as funded under those RFAs just reinforces what's required in order to be eligible to submit to these. Application and submission information. We are requesting that a letter of intent be submitted. It is not required, it is not binding, and does not enter into review of a subsequent application. The information it contains helps NIMHD staff estimate potential review workload and plan the review meeting. Prospective applicants are asked to submit a letter that includes descriptive title, proposed activity, name, addresses, and telephone numbers of the PDs and PIs, names of other key personnel, participating institutions, number and title of this funding opportunity. This is referred to, and you can learn more about this in the FOA under Part 2, Section 4.2. I'm going to go through the components. For some, I'm just illustrating what the components are. There's really nothing to be said other than to follow the instructions. But for a few of the components, we have added additional information, and I'm going to go through what that additional information is. So these are some of the components for which there is not additional information other than the only information being to follow the instructions. With regard to senior/key personnel and profiles, PDPIs of the RCMI CC must be the lead director of the CC and is the person responsible for overall management of the CC. If there are multiple PDs/PIs of the CC, MPIs will serve as co-directors. Relationship between the RCMI CC and the RCMI U24 centers will be one of equal and substantial partners in all joint activities. The RCMI CC team should have significant experience and knowledge in 1, basic biomedical research, behavioral and social sciences and clinical research, 2, program management and coordination, and 3, in support of activities to support diversity in the scientific research workforce. For the budget, we do have a few additional, a little bit of added information. The RCMI CC will be responsible for organizing and attending annual face-to-face meetings meant to facilitate coordination across RCMI U24 centers and any subcommittees in which they participate. The RCMI CC application budget should include funds for organizing the annual meeting and for travel of the RCMI CC PDs and PIs and other key personnel to the meeting. The RCMI CC is not responsible for the travel of participants from individual RCMI U54 sites. In the research plan, I do want to bring attention to the research strategy and letters of support, and I'll do that in some following slides. For the research sharing plan, individuals are required to comply with the instructions for the resource sharing plans as provided in the SF424 application guide. Following modifications apply. That is, you have to include a data sharing plan. With regard to the appendix, only limited appendix materials are allowed. Be sure to follow all of the instructions for the appendix as described in the SF424 application guide. The next few slides cover 9 items that are to be addressed in your research strategy. In the RFA, they are not numbered as I have numbered them here, but I've numbered them just to facilitate their presentation and subsequent discussion. Describe how the RCMI Coordinating Center will work in close collaboration with approximately 18 to 20 RCMI U54 centers to facilitate and coordinate RCMI program activities nationally. Include plans for fostering communication and collaborative research arrangements between the U54 centers, such as through arranging and hosting monthly PD/PI conference calls, as well as similar calls and support for the various U54 cores as needed, as well as providing logistical support to the U54 centers and NIMHD staff to arrange a yearly RCMI grantee meeting. Include plans and mechanisms for maintaining active involvement of all U54 sites in all aspects of the program. 2. Describe plans and mechanisms for providing methodological consultation to RCMI investigators on study design, regulatory compliance, biostatistics, and other technical areas to augment expertise and research resources at individual U54 sites. 3. Describe plans for developing and maintaining a secure database to collect information from RCMI U54 centers on scientific advances from full research projects and pilot projects, as well as career development of pilot award recipients. Include plans for working with U54 centers to develop, adapt, or use existing common structured data elements and performance metrics to assess progress on achieving programmatic objectives. 4. Describe how the RCMI Coordinating Center will support RCMI activities aimed at diversifying the scientific workforce in basic biomedical research, behavioral and social sciences, and clinical research. Include plans and mechanisms to facilitate broad access to research mentors and other resources that can enhance the competitiveness and career development of diverse investigators. Highlight how the relevant expertise of the RCMI CC team will support these activities. Describe plans to assist community efforts at RCMI U54 sites to develop, maintain strong working relationships with community partners, increase minority participation in health-related research, and 3, promote timely dissemination of research findings to communities to help address their health-related concerns. 6. Describe how the RCMI CC will function to serve as the RCMI program's point of contact for linking the U54 centers with other NIMHD-funded centers, other major NIH extramural programs, and the broader scientific community to promote collaborations in priority areas of research, biomedical, and basic biomedical research, behavioral and social sciences, and clinical research, especially in topics related to minority health and health disparities. Describe plans and mechanisms for informing and making visible scientific advances of RCMI investigators and affiliated scientists, the broader research community, scientific policymakers, and other relevant stakeholders. Include plans for maintaining an up-to-date RCMI website with links to each RCMI U54 site and the NIMHD. 8. Describe the organizational plan and management structure for providing leadership and administrative support for RCMI CC activities and interactions with U54 centers and NIMHD. Delineate the roles and responsibilities among key personnel at participating organizations. Include plans for ensuring accountability for achieving program objectives. And describe how the steering committee or any other advisory group will be used to ensure successful completion of the stated aims. applicants should avoid naming potential members of an advisory group unless such persons have been consulted or contacted. 9. Please include a plan for evaluating all activities supported by the RCMI CC in line with the broader RCMI program goals. The evaluation plan must specify baseline metrics to be included for the participating RCMI U24 centers, numbers of research grant applications submitted and funded, research publications and other forms of scientific dissemination, scientific collaborations and partnerships, utilization/expansion of shared research resources and databases, as well as measures to gauge the short and long-term success of the RCMI CC in achieving its objectives. RCMI CC letters of support. Applicants must provide letters from the appropriate high-ranking institutional officials that, 1, indicate the commitment of the institution to the RCMI CC goals and how its activities will be integral to the broad institutional vision for biomedical, behavioral, and/or clinical research. Specify any institutional support, for example, financial support, dedicated space, salary support for professional or administrative staff, interface with other grants, centers, and initiatives, etc. Indicate the commitment of the institution to participate in the RCMI program nationally and other national consortia, working towards developing, adopting, and implementing best practices in basic biomedical, behavioral, and/or clinical research and training. Inclusions of letters of support in the application should adhere to the SF 424 instructions and be combined into a single filed attachment. The letters of support attachment should begin with a table of letter authors, their institutions, and the type of each letter, parentheses, institutional commitment or resources, collaboration or role in the project, potential or current user of a resource or science provided in the application, close parentheses. Award information. This is a cooperative agreement. This is a support mechanism used to be substantial federal, scientific, or programmatic involvement. Substantial involvement means that after award, NIH scientific or program staff will assist, guide, coordinate, or participate in project activities. This is described more fully in the FOA section 6.2, and you can see that for details. Clinical trials are not allowed for this. This FOA only accepts applications that do not propose clinical trials. NIMHD intends to commit $1 million in fiscal year 2020 to fund one award. Application overall budget cannot exceed $650,000 annually in direct costs, excluding consortium indirect costs. The proposed project period cannot exceed 5 years. At this time, I'd like to invite my colleague, and I need to share, please unmute yourself, Marilyn,
Yes.
and take them through this section.
So good afternoon, everyone. The application will be examined for completeness and for responsiveness to the requirement of the RFA. The NIMHD scientific review officer will assemble a panel of experts from the extramural community to peer review the scientific and technical merit of the application. For preparation for peer review, so the FOA specific characteristic, the program goal, the mechanism specific characteristic, the review criteria specific to the FOA, and additional review criteria. Okay, administrative review of the application. The SRO will look at the RFA requirement, the personal and the expertise that is needed to review your application. So reviewer selection, the reviewer will be selected as needed. We will determine the scientific expertise that is needed and the collective content of the application. We will be very careful of the conflict of interest, and we will have a diverse representation by gender, demographic, and geography of panel members. So the review process, we will have the reviewer write a pre-meeting opinion. We will have, during the discussion, we will get an overall impact score, and Sarah will write a resume of this discussion, and the summary statement will be released around 30 days after the peer review meeting. So for overall impact, we have like a normal significance investigator, innovation, approach, and environment. And so I will say that it's very important for you to read the review criteria, because you will be score in function of the question down in this review criteria. So try to make sure that you know what the reviewers are going to look at. Also, in this case, but human subject protection is looked at, the inclusion of women, minority, and children, which we do now as the life, and other criteria like biohazard and vertebra, and I'm not sure it is important for this for. Also the slide, so normally there is other application information which is assessed but is not included in a determination of the impact score. The select agent research sharing plan, and the budget and the period of support. This is not counted in the score, but the reviewer have to look at it very carefully and recommend and tell us if they have any recommendation. So depending on the number of application, but some application can be streamlined, which also mean non-discuss. May undergo a selection process in which only those applications that deem to have the highest scientific and technical merit, so generally the top half of the application, will be discussed and assigned an overall impact score. The final impact score is based on an average of all the voting reviewer multiplied by 10. 10 being an exceptional score and 90 being a poor score. And like I said previously, the summary statement for all application will be available approximately 30 days after the review meeting. What I'm going to ask is, please do not contact the members of the review panel. If you do so, it would be quite a problem. I think my last slide is a few link that you can go to and check about the review process. The next slide, if you phone the NIH, if you have any problem, until the submission of the application, it's much better to call the program officer, and after you can call peer review once the application has been submitted, and once the discussion has been done, please again call back the program officer. And I have a timeline. The letter of intent is due by April 5th, 2020. So you can also get letter of intent after April 5th. We would like to have them by April 5th, but if you think you're going to submit something and you didn't know by that date, please still send us a letter of intent. The application due date is May 5th. The peer review meeting will be around July. The council review will be August, and the earliest start date will be September 2020.
Thank you so much, Marilyn. Now is the time for questions. If you have any questions, you can use the chat box to communicate with us. And this is we're going to begin the question and answer period for a little bit, but these are our contact, this is our contact information in the event you need to contact us in the future. Please use the chat filter. All right, so one question I have is, what are the eligibility requirements again? So in the FOA, you'll see that number one, to be eligible for this RFA, you have to have had an RCMI award under RFA MD 003 006 18-12 or a PAR. Let me just pull up that slide so that we can go through them, or a PAR 11-32. And in order to have had one of those, you had to have met the eligibility requirement for the RCMI program, which is listed pretty explicitly in the FOA. Let me see, just a minute. There's some other questions. Are there any limitations to submit more than one application? An institution can only submit one application. Yes, the PowerPoint slides as well as the recording of the presentation will be made available as soon as we can get them cleared and uploaded. Are applicants expected at the time of submission to have existing relationships with community relationships and to some degree relationships with RCMI U24 sites? They aren't required to have existing relationships with them, but they certainly need to be able to establish whatever relationships are needed in order to fulfill the obligations of the coordinating center, which requires extensive interaction with the existing U54 sites. So here's the full question or comment. Thank you for the presentation. The list of required activities are quite extensive. Regarding the annual conference, is there a limit on the number of conference participants and registrations? We have not identified a limit. We would think that one would limit the participants and the registrations according to the purpose of the conference and the critical individuals that need to be invited. And if that didn't answer your question, please submit another one, a follow-up to that. Are RCMI institutions expected to contribute cost/share? With regard to the conference, there's no expectation. That the expectation is, and the budget provides for the RCMI Coordinating Center to sufficient funds to host the meeting. They are not required to provide funds for RCMI U54 staff and or key individuals to travel to the meeting. That is not a cost that the coordinating center will bear, but RCMI U54s have budgeted amounts for conference travel. Are RCMI institutions expected to cost/contribute share for the, with regard to the coordinating center? We don't foresee that there'll be costs that the coordinating center will be passing along, but they may propose that in their application. There's nothing to say that they cannot um, uh, invite or ask institutions to share in any cost. I don't think I think the RFA is quiet on that, and so they may propose that. Whether or not that will be something that's agreeable under this U24 is yet to be determined. Um, there's no requirement that the annual face-to-face meeting. So here's the question: does the annual face-to-face meeting need to be held in Bethesda or Washington, D.C.? That was not stipulated, I do not believe, in the FOA. I think that will be left up to the coordinating center in their proposal. Question was regarding limit to the registration fee. We have not uh, identified that the annual meeting or any of the meetings in terms of what a registration fee would be. That's left up to the coordinating um, center applicants to discuss, and I suspect it's something that will be determined once the meeting has been developed, the agenda has been developed, the location, and all of those things have been determined. Here's a clarification. Cost share refers to other programmatic areas such as biostatistics and informatics expertise, etc. So in the FOA, we do talk about the ability to provide consultation to the U24 sites and to facilitate other things. We would hope that that cost could be part of their operating budget without the need to charge a fee to the participating RCMI sites. However, RCMI sites do have dollars to support various things. So I think that's something that the applicants for the CCC uh, will either propose or have some discussions prior to with program in terms of its allowability. Are there any other questions? I don't hear any other questions. At this time, we can take a little bit of a gamble, and if you need to unmute your mic in order to ask a question, rather than submit it through chat, I think we have a few more, some more time, so we can try that. And if it gets unwieldy, then we'll go back to the chat. But at this time, if you want to unmute and ask a question, please do so. Also, here's a question regarding the COVID-19 situation in many of our institutions. Is May 5th date a date which could be reconsidered? The NIH has provided extensive notices regarding COVID-19. And if you go to our homepage, the NIH homepage, you'll see a big banner. It's all in red and white writing, and it links you to, it takes you to another set of links where we discuss, where it is discussed or guidance is provided regarding all things related to grant applications. We are anticipating that even under these circumstances, applications will arrive to us on time. But if that seems to be something that is a challenge, please consult the guidance that's available at that time. Our guidance is being updated, it seems like weekly, and I would consult that guidance if needed. If for some reason you anticipate that your application is just not going to get here in time and it's due to an extenuating circumstance associated with COVID-19. But our expectation is that applications will be able to meet that date.
Hi, can you hear me?
Yes.
This is Elizabeth Lucili from Morehouse School of Medicine. I just had a quick question regarding sometimes other U awards allow a 2-week submission grace window for individuals on active study section at NIH. Just wondered if this was, as long as it's one of the PIs or multi-PIs, just wondered if this was available to this mechanism.
Marilyn, did you want to speak to that?
Sorry, I don't know what the 4 says about that, but maybe Tom knows what the, but you have to be careful that these 2 weeks is not always available to everybody, and and there are changes about this extra 2 weeks of submissions. So we have to look at this more closely.
Marilyn, thank you. I think the RFA says that there are no late applications will not be accepted.
Okay, so no late application, except like what Derek just said, just look about the COVID-19 to see what the NIH says about any late application.
Thank you. Are there any other questions?
There's a question online.
Oh, okay. So it says, historically, the cost of each biennial RCMI grantee meeting has exceeded $300,000, or past meetings of this type is what NIMH envisioning. The kind of meeting that we envision is based on where we are today and the needs that we foresee for the U24 RCMIs. So I wouldn't be committed to, and I wouldn't commit, and I don't think you should be committed to trying to replicate what was done in the past, but more to think about what this new opportunity for the coordinating center to do in terms of how conference and grantee meetings should be held for the U54 to meet the objectives of the U54 RCMIs and the objectives of the coordinating center. So another question has come through on the chat. It says, but the RFA stipulates that the face-to-face meetings need to involve PIPD, pilot awardees, researchers, core leaders, etc. So with regard to that, I'm not quite sure how that relates to the previous question, but yes, the RFA does stipulate what types of meetings need to be held, and we would anticipate that the applicants would be responsive to what the RFA is stipulating. Are there any other questions? So if you happen to have other questions, feel free to send them to me. If they're assuming they're dealing with program, or if there's some specific questions related to review that you may have, you can send them to Marilyn. Otherwise, I want to thank all of the attendees for their participation, for your time, for your questions, and to apologize for some of the glitches that we had in the very beginning of the meeting. But we look forward to the submission of your application and applications, and we wish you the very best. And again, don't hesitate to contact us if you have additional questions. With that, I'm going to close.
Thank you.
Okay, thank you. Thank you. At that, I'm going to close the meeting, and be safe. Thank you.
Thank you. You too.